Welcome back to the office. Thank you for coming in today. You are right on time for your annual visit. So I'm going to go ahead and get my gloves on so we can get started with your skin examination today. So you're just here for your regular checkup, correct?
Yes, that's correct.
Alright, we are all good to go, so apologize for having you under my bright light today. I forgot to charge my loops before I got started today, so of course I'm having to compensate by using one of my bigger lights, but that way I can have a pretty good look at your skin as a whole. So are there any areas of concern for you today, or are you just wanting to make sure that you keep up with your annual visits to check for the regular things that we look for, like melanoma?
Yeah, I'm fine with just a regular once over. I don't have any problem areas, I don't believe.
Okay.
Sometimes my nose or my forehead may be a little bit dry, but that's about it.
Okay. A little bit of dryness, okay. So let's go ahead and have a look here. So just starting by assessing the overall state of your skin, as well as looking at the texture, looking for anything abnormal. Now I did review your notes from last year and there wasn't anything substantial that was noted, so that's good. I do see a little bit of the dryness that you were talking about around your forehead, but it's not too severe. It's actually pretty mild. Just using my fingers to very gently separate your skin here and having a look inside those kind of fine line areas. So as a whole, I would say your skin does appear just very slightly dehydrated. Have you been drinking enough water?
I have, but it's been very hot these last few weeks.
Okay. It has been very hot, so I would say it's important to drink more water than what you would say you drink normally. That way you know that you're supplementing whatever elements, whatever salts, all that you're losing in your sweat, okay? So of course in the summertime we tend to sweat more and we're losing more water than we would normally, so it's important to hydrate more than you would in the cooler months. So it's good that you're aware of that. So just having a look at the more frequently congested areas, like around your nose. I am seeing some slight congestion as far as blackheads go on the tip of your nose there, but that is totally normal. And of course, having a look at the beard here, looking for any signs of abnormality there, any sign of infection within the follicle, also known as folliculitis. Can be more common in the summer months. So far, not seeing anything here. Okay. Also having a look at the hairline, making sure that I don't see any abnormalities here. Okay, very good. So you have a very healthy hairline. Hair is very full, nice and fluffy. That's a good sign. Do have a bit of a widow's peak, which is completely normal. Okay, so I'm going to go in with my magnifying glass. Just keep your eyes closed for me because this is just a little bright, okay? So just having a bit of a closer look here. Looking in those pores. Looking for anything that could be concerning, especially while we are in the heat of summer. I want to make sure that we are checking on the health of your skin. Areas that we tend to pay less attention to are the lips. And your lips look very good. I'm not noticing any cracking. I would say they do look just a little bit dry. Do you tend to wear any chapstick or lip balm, lip moisturizer, or even like a Vaseline?
No, I don't.
Okay. So that's something that I would recommend that you begin incorporating. I know in a lot of my male patients, they don't want to wear it because it tends to look a little bit shiny, and that is understandable. So what I would recommend when you get out of the shower, your skin is the most hydrated because you have sucked up some of the water that you used to shower with. So if you can, when you get out of the shower, I would put on just a little bit of Aquaphor, a little bit of Vaseline on your lips before you go to bed, okay?
Okay.
All right. Very good. Okay. And having a look at the eyelid. I do see just a small freckle here on your eyelid. I don't remember noting this in your appointment last year. Do you know if this is new?
I'm not sure.
Okay. So I do want to just make a note of that here. So it is a very small freckle on the left eyelid. And again, I am seeing just a little bit of congestion along the bridge of the nose there. Okay. Alrighty, James. Let's go ahead and move on to just a couple palpations. So, of course, I'm just going to be feeling around. I want you to let me know if anything is uncomfortable, okay? Okay. Any discomfort along the hairline? Okay. As well as just gently pressing with my fingers, and this just helps me feel for the overall state of the skin as well as the plumpness. And it does feel pretty healthy. You have very full cheeks, which is good. Any pain or discomfort here?
No pain.
Just checking around your nasal labial fold here. Can I have you puff your cheeks out like a blowfish? There you go. Okay, you can go ahead and relax. Thank you very much. So just having a look at your lashes. Do notice a little bit of tearing of the left eye. Is that normal for you?
Yes, it is.
Okay. So do you tend to just have overly watery eyes?
Yes.
Okay. So I'm just going to have a feel inside your beard here. So just feeling for any lumps or bumps, any possible ingrown hairs that may have become infected. So far not feeling anything. Very good. And along the hairline feels good as well. So just having a quick peek at your ears. Do you ever have any trouble with your ears?
No, not usually.
Okay, good. Okay, so I'm going to have a very brief feel around your scalp. Any issues with your hair recently?
Nothing.
And how frequently are you washing your hair?
About every other day.
Every other day, so pretty frequently. Do you ever notice any dryness of the scalp or anything concerning there?
No, nothing concerning.
Okay, perfect. So just going in with a bit of a comb, I'm going to have a very brief inspection of your hairline here. Just making sure that I don't notice anything abnormal. So looking for any flaking, any signs of dry skin or anything that could indicate possible infestation, such as lice or ticks of any sort. Now, of course, I don't suspect that, but it's always good to make sure. Also looking for any signs of alopecia, tension or otherwise. We tend to see that in the hairline here. All of that looks very good. And just taking a quick peek at the scalp, looking for any abnormalities in color or texture. Scalp color is within normal limits for age and ethnicity, so that is a very good sign. And of course, I'm not noticing any adverse signs there, so that is very good. I do see what appears to be a cat hair. Do you have a cat?
Yes, I do.
Okay, she sent one of her hairs with you. Make sure you wouldn't forget about her. Okay, alright, James. So as with all of your visits, I'm just going to proceed with a very brief set of measurements here, okay? So just checking for symmetry. So I'm just going to measure from your eye here. I do apologize, this is a little cold. Okay, that looks good. Very good. Perfect, okay. Measuring your cheeks. Good. And I'm just going to measure your face in thirds, so starting with your forehead, bridge of nose, top lip, and lips to chin there, and that looks very good. Okay. And your nose does extend slightly further than the inner corner of the eye, but not as far as your lips there, so that is very good. Okay. So face is fairly symmetrical. Good news. I'm sure that's not something you think about very frequently, but it's always good to check. Okay. Just performing a couple tests of your skin integrity. So I'm going to be tapping around with my reflex hammer. Now what this does is essentially allows me to see the reaction in the elasticity of your skin, okay? So when I tap down with my hammer, your skin disperses around it and then pretty immediately comes back to the surface, which is what I'm looking for. So if there's any lag in your response there, then we could be looking at a bigger issue here, okay? So just going to perform some tapping along various areas. And essentially just looking for a reaction in your skin. Good. Very good, okay. So I would say everything is looking okay. Maybe some very mild signs of dehydration, but definitely nothing that I would say is super concerning, okay? Okay, very good. All right, James. So I'd like you to let me know if you can feel this here, okay? Can you feel that?
Yes, I can.
that?
Yes, I can.
You feel it?
Yes.
Feel it here?
Yes.
Feel it here?
Yes.
Feel it here?
Yes.
You feel vibration here?
Not really.
Not really. How about now?
About the same.
About the same. You feel vibration here?
Yes.
Okay, good. How about here?
Yes.
Good, okay. You can feel that this is cold.
Yes, I can.
Okay. And this feels cold all around.
Yes.
Good. Okay, very good. Okay. Cheers. Going to go ahead and proceed to the next portion of your examination, and similar to the previous test, I'm going to be using this tool to press into different areas of your face. This is going to allow me to produce an indentation in your face, essentially just testing to see how long it takes for that indentation to dissipate here, okay? So just pushing gently. Good. Okay, so no cause for concern there. So I'm just going to go in with this tool here, and this is just going to allow me to gently slide across certain areas of your skin. And essentially I'm just looking for any excess production of oil here, okay? So if there is any oil lying underneath the surface, this tool will allow me to kind of bring it to the surface so that I can see where you have the more congested areas, and if need be, we can address that. So just gently sliding across the sides of your nose, and I actually am not seeing much of anything here. Very little bit of oil production there. And on this side, same thing. Very good. Do you wash your face regularly?
Yes, I do.
Okay, very good. Just having a look at some of the congestion on your nose. Looking to see if any of these blackheads are dislodged or if they are kind of deeper into the surface here. It does appear that they are a little bit deeper. Okay, very good. And having a look at your cheeks. A little bit of oil production here. Not much. Good. Okay. Alright, James, so I'm just going to have a little bit of a once over. It does appear that everything looks okay today. Just looking to make sure we didn't miss anything. As a whole, it looks like you take very good care of your skin. I would continue with your regular skincare routine. At this time, I don't think it's necessary to add any specialty steps. The only thing I would say is you could do with a little bit of a maybe stronger moisturizer, a thicker moisturizer on your forehead as well as the sides of your nose. Other than that, I would say your skin is looking very healthy. Try to up your water intake just a little bit if you can. Even an extra cup or two a day makes a pretty significant difference. Unfortunately, when your body is utilizing water, your skin is kind of the last thing on the list. So it's going to all of your vital organs, and your skin is getting a little bit of the short end of the stick. So try to rehydrate adequately if you can. And of course, make sure you're wearing sunscreen, okay? You want to wear sunscreen every single day, even if it's not sunny, even if it's raining. Anytime you're outside for more than 15 minutes, you really should be wearing sunscreen, okay? Okay. All right, James. Well, I would say that's good for today's visit. You are all clear as far as I'm concerned. I will go ahead and update all of this in your chart. And if you'd like, you can head to the receptionist desk and we can go ahead and schedule you for next year's visit, okay?
Okay.
All right. Well, perfect. Thank you so much for coming in. It's very nice to see you. Make sure you get home safely, okay?
Yes, thank you.